Hello, my name is Inos. Welcome to my channel. This is Work and Wonder, and today we'll be talking about mental health OSCE. If you're a nurse, you're a mental health nurse, you're a midwife, consider subscribing to my channel. I talk about nursing stuff a lot on my channel. Today I'll be talking about the mental health OSCE because I myself, when I was getting ready for my exams, I searched on YouTube and it was very difficult finding videos on some of the stations in mental health OSCE. So this is a series that I've put together, and I'll be taking the stations one by one and I'll be talking about them. So if you're a nurse or you just got into the country as a mental health nurse, consider subscribing to my channel and you get an in-depth knowledge on what to expect on the day of your mental health OSCE. Without wasting my time, let's delve straight into the mental health OSCE. So the mental health OSCE, just like the adult nurses, also consists of 10 stations, and each of the stations you are timed. Sometimes that's what makes it difficult, but it's not really difficult. It's just about practicing and knowing your marking criteria. So as I said earlier, it's made up of 10 stations. Just like the adult nurses, we also have the API, which is the assessment, the planning, the implementation, and the evaluation. Then you have 6 sets of skills, right? The skills is 6, and then out of the 6 you'll be tested on only 4. So as compared to the adult nurses who study about 14 or 15 and then they are tested on only 4, you can see that with the mental health is quite easier. So 4 plus the API, which is 8, and now you have the next one is evidence-based and professional values, which you get 1 each out of them, making it 10 stations. All in all, in the mental health OSCE, you have about 4 written stations, and I'm just going to run you through because this is just an introductory video to the whole of mental health OSCE. I'll be taking it one after the other in my next videos. Let's start. So with the API, just like in the adult nurses, here you have 20 minutes to start and finish your assessment stage. Mental health OSCE assessment stage is all about talking. You are giving the patient, you talk to the patient, you get to know the patient's risk factors, you get to know whether the patient has capacity to keep himself or herself safe in the community or not. If yes, the patient will continuously be nursed in the community. If no, then the patient is to go to the hospital, and it is in 2 phases. Either the patient is consenting to the hospital or detaining or not. The patient is consenting, the patient is an informal patient, the patient comes in willingly. But if the patient is not consenting, then the patient will have to be sectioned under a mental health act, and in that case the patient is a formal patient. Alright, in the assessment station, all you need to know is that during your assessment you need to have 2 problems, or you need to come out with 2 problems. The patient need to tell you 2 problems, or out of the mental health examination, you yourself will be able to identify 2 problems, and these 2 problems you will carry it to the planning stage. The planning stage is the first written station in mental health OSCE, where you are going to use your 2 problems to draw a care plan for this particular patient. This station you need to spend 14 minutes, so 7 minutes each for the 2 care plans that you would be drawing. Now let's move on to the next stage, which is the implementation, which is 15 minutes. Implementation, basically you'll be administering psychotropic medications. Psychotropic medications are basically medications that are used in mental health: antidepressant, mood stabilizers, antipsychotics. These are basically medications that you would be administering in the implementation stage. And here it could either be a community setting where you go to the patient house to administer this medication, or the patient is going to be on admission and you'll be administering this medication. So make sure you read your scenario very well before you start your implementation. The same applies for assessment and planning as well. Then when you are done with everything, then we have the evaluation. Evaluation, basically what you'll be doing is you'll be handing the patient over to somebody. In most mental health situations, you'll be handing the patient, if it's from the hospital setting, you'll be handing the patient to a community nurse, and you use what we call the SBAR, situation background assessment recommendation. So you have tell the patient history, whatever interventions was given to the patient, medical intervention, nursing intervention, psychological intervention, occupational therapy interventions, Then you also talk about some areas of concern, then you give your recommendations, then you are done with the API. As simple as that. The evaluation stage is also 8 minutes. 8 minutes. Now let's move to the clinical station. Clinical station, as I said earlier, you have 6, and out of these 6 you'll be doing only 4. Very interesting, right? Yeah, only 4. The first one is administration of suppository. You know that most psychotropic medication has a side effect of constipation in the mental health setting. So basically, these suppositories will help ease this constipation. So this is a station that you'll be doing in a clinical station, which is just 10 minutes. 10 minutes. So here you have to be very fast. You need to know your prescription, and then you need to read your prescription as well. Then the next one is de-escalation. De-escalation, basically you have a patient that is so aggressive or so annoyed about something, and then you are asked to go in and talk with the patient to calm the patient down. But the good thing about de-escalation is that it is a written station. So you are given the scenario, and then you will write what you would do. All right. Then the next one is nutritional assessment. Nutritional assessment is basically into 2 phases. We have the first part, which is the written, and the second one you hand over. You use the tool we call the MAST. The MAST tool, where you'll be calculating BMI, you'll be calculating overall risk for malnutrition. Right? You at the end, you either have a low risk, you have a medium risk, or you have a high risk. And each of these categories have some interventions that you would be implementing. So at the implementation or at the oral stage, when you are handing over, basically if the patient was at high risk of malnutrition, you tell whoever you are handing over to what you do. If it is a medium, you tell the person what you do. If it is high, you tell the person what you do. As simple as that. And with this one, you also have 10 minutes to complete it. Then the next is physiological ops, which is also known as vital signs. Here you are also to use only 10 minutes. Then the last two for the clinical station is reminiscence therapy. Reminiscence therapy is mostly used in dementia, people that easily forget stuff. So reminiscence therapy is just to stimulate their mind to remind them of some good things that will help in their therapy. So basically you're presenting them with items that you ask them what does it remind them of, and that kind of thing. And within just 8 minutes you are supposed to finish this station. It's a very simple procedure. And then the last one is talking therapy. Talking therapy, basically you are the nurse and you go to talk with the patient. You try to recommend a certain type of talking therapy for the patient, and if the patient accepts it, they are going to set up an appointment with the psychologist, and the patient gets to start his or her talking therapy depending on what talking therapy you recommended for the patient. So when you're done with this, that is 8 stations gone. As simple as that, right? Then you just have only 2 stations left. The 2 stations is the evidence-based, which is 8 minutes, and then professional values, which is 8 minutes. These two have about 14 of them. It's more or less. Let's talk about the evidence. The evidence is basically they are presenting you with some form of situation. A patient is asking you whether ibuprofen is better than paracetamol or not. They give you an article, and based on this, you are going to write your answer. It's also a written station. Right, you're going to write your answer. There are about 15 scenarios, and you only be given one. The same applies to the professional value. They are testing you to see what you do if you find yourself in some situations. Something like you make a drug error. What are you supposed to do? Evidence that will be professional values. Professional values too, and it's also a silent station. So you write what you do, and all these has a marking criteria. Marking criteria, you must meet all of them, right? Once you write to meet the marking criteria, you definitely pass that particular station, which is very simple. In fact, evidence-based and professional values is one of the simple stations, both in adult nurse and learning disability and mental health, that you can ever get. So basically, this is an overview of the mental health OSCE nursing in the UK. In the coming days, I'll be doing individual videos on each of the stations. So I'll pick assessment, and I'll be doing a full video on it, what you have to expect, what you're supposed to do, and then if possible, I'll get a colleague which I'll practice with and then video, and then I'll also upload it for you. So if you're a mental health nurse, you might consider subscribing to my channel, and there's a whole lot of educative content that I'll be posting that will be to your benefit. So make sure you give this video a thumbs up, you subscribe to my channel, and I'll see you in my next video. I'm out.